everybody, and welcome to Leading Entrepreneurs of the World. My name is Glenn Turansky, and I am a member of the advisory board here at One Business World. Leading Entrepreneurs of the World features entrepreneurs, founders, and business leaders presenting on cutting-edge topics and the latest in industry developments. Our goal is to provide the global business and entrepreneurial communities with a window into the minds of those who are shaping the future of our world. Today, we're very pleased and honored to welcome leading entrepreneur, mentor, and company builder, Michael Gorton. Michael is the CEO of Recuro Health, an integrated digital health solution that evolves healthcare from a reactive, disease-focused model to a personalized, proactive system. Recuro's virtual health platform consists of a curated suite of digital solutions from primary care and behavioral health to at-home testing and genetic screening. Fully customizable, these solutions can be tailored to meet the needs of any population, allowing patients to engage with physicians, receive more personalized care, and monitor their own health, no matter their location or circumstance. Prior to his current entrepreneurial leadership role at Recuro, Michael was at Teladoc, where he served as the founding CEO and pioneered an industry-changing healthcare model that created a new efficiency paradigm in healthcare by delivering physicians to patients nationwide in under 12 minutes for $35. Teladoc listed on the NYSE a few years back and now has a market cap of over $30 billion. Michael's decades of experience as a strategic visionary impacting the telecommunications, music, and healthcare industries includes a leadership role as the founder of Principal Solar, where he applied his business expertise, scientific education, and training to the renewable energy sector, a strong voice and proponent for solar power. He's also served as a partner for the Texas Acceleration Group, an entity formed to assist startup companies, and participated as the founder of Palo Duro Records. He is also credited as the founder of Internet Global, a company that delivered the first DSL network and one of the first voice over intercom protocol networks. Prior to this, he worked as a project manager and engineer at Dallas Power and Light, dealing with power plants, distribution, transformer management, and integration of renewable energy into the grid. Michael, that's an amazing biography and background. Welcome to Leading Entrepreneurs of the World. We look forward to your disruption in healthcare discussion here this morning, and let me hand it off to you. Welcome.
Great, thanks. Well, I'll just share my screen. I want to say, first of all, thank you, Glenn, for inviting me in. It's always an honor to try and inspire some of the other entrepreneurs and educate some of those who are investors. So let me just start off with this. So, Teladoc is obviously the big company that everybody recognizes, but there's a lot more kind of woven in. And I want to start with a little bit of background. But first, because I'm such a big believer that we don't get to the top alone. We have to have the support of others. I like sharing my LinkedIn because if there's anything I can do to help give back for all of those great mentors that got me this far down the road, I'm happy to do so. And so, you can either take a screenshot of this or just go to LinkedIn and look for Michael-S-Gorton. So let me start with a little bit of background. I grew up poor. That's me at the top in that white shirt waving. And, I said, I've actually met people who are destitute. That's not what we were. We were kind of on the upper side of the poor class or way down below the bottom end of the middle class. But the thing that I learned when I was a young kid growing up was you can accomplish anything. That was what my parents always told me, and I was lucky enough to be in the Boy Scouts, and my Boy Scout leader often told us. And in 1969, I sat and watched this on the television, and it changed my life. My scout leader at the time said, if you like that and you want to make a plan, then do exactly that. And so I created this idea that, I could go off and get all these degrees and maybe be the first man on Mars. And it started with inspiration, and I think inspiration is the perfect starting point for anything. And if you have it, then the next thing you have to have is the persistence to get to that end zone. But this is where I started, right here. This is actually one of the most famous pictures ever taken. And when I was a poor kid, I never would have guessed that later in my life, this man in this photograph would become a friend of mine. But one of the things I love about this photograph, for those of you that don't know, this is called the visor shot. The guy who took this was Neil Armstrong, the first man to step on the moon. And the man in the picture is Buzz Aldrin, who went to the moon with Neil. And if you look in the visor of Buzz Aldrin here, you'll see Neil Armstrong right here holding the camera. You'll see the lunar module that landed there and the shadow of Buzz. So these, and of course back here is the flag. So one of the most inspirational pictures of all time, taken and viewed by a young kid who didn't know anything about anything, who ultimately became friends with this man. And so I say this more than anything to tell you young entrepreneurs that hard work and persistence will get you just about anywhere you want to go. And so this talk is about disruptive innovation. And so I want to focus on that for a little bit. So what is that? If you have something that disrupts a market, when I was a little kid, my mom would have said disruptive is a bad word. And it's really difficult to go from that, don't be disruptive, to now for us entrepreneurs, disruptive innovation is one of the greatest things that you can accomplish. And, if we can figure out a way to change the market, then that is disruptive innovation. And, we should be able to build world-leading companies and maybe even get rich. And that's what Teladoc did. That's what one of my companies before, Internet Global, did. And so, so what are some examples of disruptive innovation? Wikipedia. When Glenn and I were young, everybody had a bookshelf in their house with 30, 40 books called encyclopedias. And they got outdated really quickly, and they cost hundreds or thousands of dollars to purchase. Now we have Wikipedia. We can get it from our computer or our cell phone, and that was a disruption. Smartphones, another disruption. So this supercomputer that we carry around in our pocket. I love the digital photography one because I remember at the end of the century when digital cameras were first coming around, and the great photographers and the big companies of the world, the Kodaks and those companies that were producing film, they said, this will never become better than film. And nowadays, if you see somebody with film, it's almost startling. So Netflix, the ability to stream video, and there's a number of others, and one of them is Teladoc. And the thing that happened with Teladoc, a lot of people will tell you this is a brand new telemedicine model. So if you're not familiar with it, Teladoc is essentially a physician, an electronic medical record, and some form of communication. In the beginning, we just used telephones, but now video conferencing is so easy for everybody that there's a lot of video conferencing and even some biometric data, and a patient. And so people just think, okay, that's telemedicine. But to me, at the beginning, Teladoc wasn't about telemedicine as much as it was about efficiency. And so, the thing that all of these things have in common is they are disruptive innovations. And in just a second, I will take you into exactly how and why Teladoc became a disruptive innovation, and what did we do? How did we handle it? But first, going back to my picture on the moon, my life plan led to things. My Boy Scout leader said, get more than one college degree. I ended up with 4. As I was coming into Teladoc, I had built 7 companies. One of them was Internet Global, which had produced a lot of disruptive innovation. As Glenn said in the introduction, we delivered the first DSL network in the world that was high speed. In the beginning of the internet, we used to use these things that were called modems. They were noisy and super slow. And we were looking for ways to increase the speed of the internet. DSL was the first one that we used, and it was disruptive. But I sold Internet Global. I got some money, and I called a bunch of friends, and I said, let's go climb Kilimanjaro. And so we did. So if you're not familiar, Kilimanjaro is the largest, not the tallest, but the largest mountain in the world. If you put it in Colorado, it would take a little over a quarter of the state. One mountain all by itself in the savannah of Africa. And so I called a bunch of friends and said, I'm flush with money. I'll pay for everybody to go. I'll buy everybody's equipment. We can have a nice photographic safari when we're done. And so this was my team. And this gentleman right here laying down is a physician who had been at NASA, and the whole way up, he was telling me, let's build this company. It's going to be called Cyber Medical Services. The name alone made me want to go, but we got through it. We renamed it. It became Teladoc. And so I tell the young entrepreneurs these days that there really are unicorns on Kilimanjaro, because I found one. As we started building this, I had to get it funded, and nobody got it. Everybody went, "You're going to do what? No, we're not going to fund that." And even though I had built a successful company, I couldn't get any professional money to listen to me. The first operating system for Teladoc that started delivering doctors to patients in under 3 hours for $35 cost me less than $500,000 to build, and that's because we had to do it on as much innovation and creativity as we could, because everybody who I talked about it said, I'm not doing that. And one of the things they said to us often was, if it was such a great idea, then United or Cigna or Aetna or Blue Cross would be doing it. I guarantee you, almost every entrepreneur that's listening to this has heard a version of this comment. If insert the name of your company, was such a great idea, then what is your industry? That major company would do it. And the reality is, those of us in the entrepreneurial world should all know this, and that is, we're the creators, we're the disruptors. We can make a decision today and start working on it yesterday. Major corporations make a decision today, and they put together committees, and then they budget it, and by this time next year they start working on it, and within 2 years maybe it's operational. That's not the way we work in the entrepreneurial world. We move fast, and that's how we become disruptors. So if you take a step back from Teladoc and say, what were the issues? There were essentially 2 battlefronts for telemedicine in 2002 when we started this company. One was remote treatment, and the other one was interstate medicine. And so what are these 2 things? Let me start with interstate medicine. The question that we can ask in the United States is it appropriate for a physician who's licensed and trained in Kansas to treat a patient who is currently in New York City? And the answer is no. And that's not my answer. That's the answer of the boards of medical examiners who control this. So, we always joke around, I'm in Texas, and we always joke around that you know, we're not sure that an Oklahoma doctor should be treating Texas patients because those people in Oklahoma are just different. But that's just joking around. That in reality, this question of interstate medicine, it was one of the battlefronts. And as we started seeing success in Teladoc, people said to me, let's try and solve this problem. And my answer was no. And this is a lesson for all of you entrepreneurs. If you want to win, stay focused. We hear this all the time. You know, entrepreneurs are always looking for ideas, and you've got to resist that. Find your target and stay focused on the target. In the Disney movie Up, there was a dog that every time it saw a squirrel, it would chase that squirrel and chase the next squirrel and chase the next squirrel. And when you start doing that, you get 2 years down the road and you've gone nowhere. And so find your target and focus on it. In the world of, you know, I use these two tanks because every military strategist knows that if you want to win the war, you don't fight on two fronts. Find your one front and focus on it. So the one we decided to focus on was remote treatment. And that is it appropriate for a physician to treat a patient that they can't touch right now and maybe have never touched? So that was the battle that we decided to fight. And so let me focus on this a little bit. You know, one of the things that those of us who are entrepreneurs hear quite a bit from the investment community is, what keeps you up at night? Investors ask us this all the time, and we see it as kind of a trick question. What keeps me up at night? For a lot of us natural born entrepreneurs, nothing keeps us up at night. You know, we've got our focus, we've got our project, we work ourselves to the bone, we hit the bed and we fall asleep. Nothing keeps us up at night. But I'll tell you, as we were building Teladoc, Dr. Brooks and I got about 2 years down the road. We had built all the software. We had tested on a couple hundred patients. We took it to the board of medical examiners. And, you know, you can see from just listening to me right now, I tend to be a little bit passionate about what I'm doing. And so we go to the board of medical examiners with great passion. We tell them how we're going to fix healthcare. We're going to add efficiency where no efficiency existed before. And the board of medical examiner says, Mr. Gorton, if you build this company, you will go to prison. So, you know, imagine walking into this boardroom thinking, okay, this is it. The powers that be are finally going to hear us and they're going to love what we're doing. And then when you walk out that day, not such a good day. So, you know, we figured out how to get through this one, but this one was a long battle. And it was one that was ongoing for literally years. And it was one of the battles that sort of kept us up at night. But another one day, I think it was maybe 2005 or 2006, I was sitting in my office and we were growing like crazy. I'm in a meeting and my admin comes into my office and she goes, I need you up front right now. And I looked at her and I'm like, Ruthie, as you can see, I'm in the middle of a meeting. And she goes, the DEA is here with badges and guns. And I went, okay, I'm coming up front. So, you know, what keeps you up at night? Well, when the Drug Enforcement Agency comes in with their badges and their guns, you know, you definitely, it's something. And they said, you know, what they thought we were doing was using Teladoc as a tool to issue narcotics, which we weren't doing. We had all kinds of protection for that, and we felt fairly confident about it. But the agent who came in and with a couple of sidekicks told me that he was going to take every single file in our office apart. He wanted to look at every data drive. He wanted to see, because he believed that we were doing this. And they spent about 3 months. I remember about 3 months into this process, I walked into the office and he was sitting there and he did not look very happy. And he goes, you your office now. So I walk down the long hallway. He closes the door behind me and he sits down, and there's a bit of silence as I'm going, and just thinking, oh my gosh, my world has just ended. Did some doctor write a prescription for a narcotic, or what's happened? And then he just looks at me and he says, we like Teladoc and we haven't found anything bad. And how can my team get Teladoc as a benefit? Because we're always traveling. And so, that was one of the small victories that you get, that at least on that particular night, yes, I can get some sleep, a small victory along the way. But, these things happened all the time. And I'm going to go back to, my picture of Buzz Aldrin on the moon and say, look, anybody who's seen the movie Apollo 13 remembers the famous phrase, failure is not an option. There is such a remarkable scene in there where, these poor 3 astronauts are in space trying to figure out how to get home. And Gene Kranz, who's running that group at the time, throws all this equipment down on the table and says, we've got to find a solution, and failure is not an option. And they solved it. And again, I hate to be too pedantic on this, but to those of you who are entrepreneurs, you have to adopt this policy, because you're going to get knocked down and kicked in the teeth maybe every day. And if you're building something that's important, then you have to get through it. And I will tell you, through all of the challenges, all of the stress of building Teladoc, as we came into COVID last year in early March, just as it was becoming obvious that COVID wasn't going to be something that we were going to get rid of in a day or two or a few weeks, I got a letter from a former Surgeon General who sort of knew all the battles that we fought to make telemedicine accepted in the United States. And that particular former Surgeon General said, thank you for fighting those battles. Lives will be saved because of telemedicine, because the infrastructure, not just Teladocs, but every other company that had followed in our pathway and done it right, that was providing services and infrastructure. And it's sort of a funny story, because the telemedicine to me was mainstream and has been since 2002, but almost nobody knew what it was. And last year, my wife had a doctor's appointment, and the physician said, we're going to do something called telemedicine. Do you know what it is? And my wife just laughed. Of course she did. But you just never know how you get knocked down, kicked in the teeth, you get back up with a smile and you go, okay, let's do this again. That has to be your perspective. And as we went through all of these battles, 17 different states in the United States all sent sheriffs or certified mail to us saying, you're in violation of our laws, and we're going to shut you down or put you in prison or fine you or whatever. And we prevailed in every one of those. And but it just felt like a battle all the time. And then we got to our 1,000th member, and the former HHS secretary, Tommy Thompson, arranged for us to celebrate our 1,000th member in this building, the US Capitol building. And so I remember standing under the rotunda and thinking about the DEA coming into my office and all of those certified notes and sheriffs and all of the investors who had said no. And I went, wow, I think finally I can say, maybe this is going to happen. 1 million members to whom we were delivering doctors. At that point in time, we were probably under 20 minutes. And then we got to our 7th year and we had 2 million members. And at that point in time, we had gotten the efficiency so precise that when a patient wanted to talk to a physician, we were delivering that in 12 minutes for $35. We hired an independent group to do a satisfaction rating on our process and our physicians, and we got a 97% satisfaction rating. And so for those of you that don't know healthcare, almost nothing in healthcare gets above 65 or 70%. And we were in the upper 90s. And so, success was pretty profound. But in spite of that, most states still opposed it in one form or fashion. In fact, one of the states in the South, I think, maintained their opposition to telemedicine right up until April last year, as COVID was getting really crazy. And then they finally said, oh, maybe this is a good thing. Maybe it will save lives. So one of the other things that I think all of the entrepreneurs and the investors will appreciate is when I was raising money, it was mostly from friends. And so one of my early investors, a guy named Gary, who I knew really well, put $25,000 in. And I know Gary really well. And everybody knows that Gary. He still has, 9 cents of the first dime that he made. And so I called Gary last summer and I said, do you still own all of your Teladoc stock? And I remember I don't remember the exact number, but he goes, yep, and it's now worth $5,132.33. He just popped it back to me in exact terms, and so those are the kinds of success things that you say, okay, this is really cool. I have made a friend wealthy. One of the other things that happened, right after I left Teladoc, the MIT Technology Review business issue listed their 50 smartest companies of 2015, and Teladoc right here was number 27. And I think my son is really fond of telling me that Snapchat was below us, IBM was below us, Microsoft, Uber, so he was going, man, Dad, the company you started is really cool, isn't it? Yeah, it was really cool. Companies on the market go up and they go down. We've seen it in the 30s. We've seen it in the 20s. I think there's a lot of room still for telemedicine to grow. And Teladoc remains the international market leader. And, I no longer own any Teladoc stock. So I'm not saying this as a potential investor or owner of stock, but I guess every entrepreneur and most of the prudent investors will appreciate our startups are like our children, and Teladoc is my baby, and I expect her to do great things in life and otherwise. But I was going up this ladder of all these great things that were happening, and then of course in March last year, COVID changed everything. And it's interesting because a minute ago I mentioned that one of the states in the South had decided to shut down telemedicine, and I was trying to help one of the preeminent telemedicine physicians in the world at the time deal with that state. And it wasn't just him. There were, 30 or so other physicians that were, the state had said they were going to take their license and suspend and file charges and things like that. That it would have changed everything for those people. And I started doing that in December of 19 and tried like heck to convince the state that telemedicine was a good thing. And as I mentioned, in April, they finally saw the light and decided that maybe telemedicine was a good thing. And I think that particular state was the last holdout. Now, almost everybody knows what telemedicine is. It's not a niche market anymore. It is not an emergent industry. It is a growth industry. And I had more or less stayed away from healthcare and telemedicine from the time I left Teladoc in 2010 until last year. And it just occurred to me that there are still a lot of problems and a lot of things that need to be changed. And so, what I would tell you is Teladoc was just the beginning. And even though, we could claim that we were delivering doctors to patients and in a matter of minutes nationwide, everybody knows that healthcare costs have continued to go up every year. And everybody knows somebody who's been diagnosed with stage 3 or stage 4 cancer. And everybody knows somebody who's getting old and can't run and do things like they used to. And I think, there are things that we can fix right now. And so as I was analyzing where Teladoc was and how can I help them with this particular state in the South, what I realized is today, healthcare is still just a sick care system. And what I mean by that is that you pay your $1,100 a month. That's what the average healthcare fee to our payer is. That is the Uniteds and Aetnas and Blue Crosses of the world. Each person in America who's paying for healthcare pays about $1,100 a month. And if you want to get a high-end physical, the answer is no, that's an out-of-pocket expense. If you want to get a full genomics study, no, that's an out-of-pocket expense. So the things that could help keep us well are not covered in our healthcare system. And so that's why I call it a sick care system. But the thing that really ought to scare you is almost nobody makes money in our healthcare system until you're sick. Can you imagine inspiring the quarterback for throwing interceptions or incomplete passes? That's basically, and I said just a second ago, how many of us have a friend who's been diagnosed with stage 3 cancer? 50% of people with heart disease find out when they're having their first heart attack, which often kills people. And so, why is that? We have the technology to catch these things earlier. And if you ask the large payers of the world, they'll tell you, well, that's like finding a needle in a haystack. And I agree. It is like finding a needle in a haystack. The problem is that they're going one straw at a time, looking for the needle and saying, this is not worth it. And I'm saying, bring a magnet. That's what we should be doing, is bringing technology. And I started out talking about Teladoc. People will tell you Teladoc was a telemedicine solution. And I will tell you it was efficiency. What we did was we brought efficiency to healthcare, and we can do it again. We can do things like catching cancer before it becomes stage 2. We can do things like monitoring and knowing when people are moving down the pathway that will lead to heart disease. Now, not everybody is going to adhere to the protocols that we tell them in order to do that. But the ones that do will have the opportunity to stay healthy, to work longer, to not be decrepit in their 80s and 90s in a long-term care facility. And so that's what we're doing next. So Teladoc, major change. The next one is Recuro Health. And so from my chair in healthcare, it's time for disruption again. And so Glenn, I'll stop there.
All right, thank you, Michael. Wow, what a great presentation. I am a big fan of the space program. But much like you, I was in my basement with my dad in Long Island on July 16th, 1969, which also happened to be my dad's birthday. And I'll never forget that he said that the astronauts were going to the moon for his birthday.
So what did he do that they had to get so far away from it?
I tell you, well, New York City policeman. So, yeah, they landed right. They landed four days later.
Yeah.
I mean, obviously, guys like Buzz Aldrin. I mean, just American heroes. American heroes. Right. Hey, you mentioned early on about your Scoutmaster and mentorship like that. Anybody else, when you reflect back on your career and all of your success, who was one of those perhaps early mentors for you?
Sure, sure. I think the first real business mentors came when I was a young entrepreneur, and they were just helping me get through the weeds of a company. But most significantly, when I decided to become an entrepreneur, I got really lucky and managed to convince a man named Nathan Morton, who was a major international businessman. He created the business model that became Target stores, and then he helped the guys who created Home Depot, and then he said, "I'm going to do this on my own." And in the late '80s, started a company called CompUSA, which Glenn, you and I will remember. The younger people won't, but CompUSA went from, when he first started it, he said, don't computer nerds, they wear like pocket protectors and calculators on their belt. And so he built a company that became a multi-billion-dollar entity, and he helped me build Internet Global. And as we were starting Teladoc, he helped me build it. In fact, in the beginning, he said, CompUSA was a $4 billion company. Let's make Teladoc into a $5 billion company. And I went, all right, let's do it. And we were wrong, but in a good way. And unfortunately, we lost Nathan before he got to see that. But what a great mentor. And so there've just been one after another. And I'm, even though I'm long in the teeth now, I'm still looking for mentors, and I'm still looking for people that I can help.
Yeah, I do a lot of it. I'm affiliated with I'm on the board of my college and an adjunct here on Long Island. I try to do as much of that as I can, because you just never know who you may influence or who you may inspire, or just, as you said, to lend a hand. That before you could, when you could look back, you can come back and say, oh, I knew him, I knew her back when, right? Back when they were like this. It's interesting. You talk about kind of the two battlefronts and things, and I'm just back from the World War II Museum in New Orleans, and
New Orleans,
lucky to get out. But one of the exhibits that they talked about was part of the fall of Germany, or what started it was when they tried to do two fronts, right? Both the European front and then the Russian front, and that was kind of the turning of the war, at least in Europe, at that point in time. But when you look at kind of fighting the regulatory system, what a great the DAA agents, what a great lesson when they come back and said, listen, everything looks fine. How can we get this? What a great story that is.
From their chair, they came in thinking, let's shut these guys down. And then they realized what we were doing, and they were traveling all over the country, and sometimes they'd get sick. And what do they do? Where do they go? And that was serendipity.
It reminded me a little bit of the scene in Shawshank when all of a sudden all the prison guards are in the back and Andy's doing the tax returns for all the guys. It's interesting. Here we are 18 months into the pandemic, and almost you think of all the battles you fought here, and now you think of telemedicine or telehealth. I mean, it's the solution. It's in the forefront. It's a way to keep patients connected with their doctor. I kind of helped my uncle here, as he's the oldest family member still standing, and he's in assisted living, and he's had some health issues. And watching him navigate the system, when he had his heart valve replaced last year, and they sent him home with some sort of self-monitoring device. It's like, this is never going to work. Are you kidding? And you know what? He adapted. He was faithful to it. He read all the instructions. He loved the fact that he was calling in readings, or that they would call when they would see perhaps something was elevated or not particularly right. And if you can teach an 85-year-old to be receptive to that, think of all the promise for everybody younger along those lines too, right? As you kind of look forward to it. You talked about you also talked about the fact that a lot of stuff, and I'm let's see, 27 years going to the chiropractor. And I remember first going to the chiropractor, when my daughter was 3, and getting the same kind of response you did from the insurance companies. This is experimental. We're not going to cover this. This is out of pocket. And now here it is, almost mainstream, not 100%.
Yeah.
But coming back, how about the reimbursement models for something like this? You hear a lot of stories about, well, Medicare doesn't give you dollar for dollar for it. They discount it. What's been your experience with it?
Well, I think our payer system is very broken. And, that's one of the things that Recuro is going to focus on. How do we stay preemptive? And listen, I agree with you. I don't think chiropractic treatments should be considered experimental, but there probably are some. There's probably some far-fetched things that people really believe in that may never come to pass, and we have to figure out how to sift through those while we're fixing something that's very broken. But remember, Mom and our accountants always said, follow the money and you'll find the answer. And in healthcare, follow the money and you'll find the answer. That's just the way it works.
And you're right. It is a sick care system. And when you think of all of the work that could be done in advance, right, from a preventative standpoint, from a monitoring or screening standpoint, especially with cancer patients and things, getting out in front of it, partnering perhaps with local NGOs or faith-based organizations or other not-for-profits. There's lots of trust out there in the community, and if we're able to kind of fix that and build that trust and get it out, promoted a little bit more, we could fix it. As you said, we can move from this sick care system where people are waiting to get sick in order to bill and get paid, versus, in the long run, we're being more efficient. We're saving money, almost like a success fee in a way, kind of when you think about entrepreneurship and things like that. It's kind of a, you could almost argue it could become a similar model like that, right?
Yeah.
How about any thoughts around, you also see a lot with healthcare now with outcomes, right, and value-based reimbursement things. How about telemedicine or telehealth along those lines? Do you see promise there?
Yeah. Well, one of the things that I think that sort of fits into that category, but not perfectly, is the fact that we are spending a lot of money on treatment rather than cure. And it's sort of a scary thing, because again, in the United States, we are a capitalist country. To some people that's a bad word, to some people it's a good word. Capitalism has delivered a lot of good, but I think we have to sort of change our philosophy a little bit when we look at the difference between a treatment and a cure. And so if I'm a pure capitalist and I have the opportunity to develop a pill that cures something or a pill that treats something, oftentimes I'm going to go the wrong way. And we've got to figure out a way to, inspire the other side of it. Let's cure it, not treat it. I didn't take my first aspirin until I was probably in my late 20s, just because I thought, okay, something else is going on there and I want to feel it until I figure out what it is. And all the aspirin is doing is it's making the pain go away. And so, how do we change that mindset? And I think it may take generations, but we have to decide that is what we're going to do.
Your Apollo story that you started with, and you're right, it's one of the more iconic photos that we've ever had. That self-reflection visor shot. But a lot of what you've done with your career and the disruptive change that you put forth for the good here, you could almost argue kind of what they said at the moon, that famous quote about one small step, right? You're kind of doing that. Yeah. You're kind of doing that here, but on the healthcare side, and for really the greater good. When you look forward to, and to the point that as it becomes as people become more comfortable with it, it'll become almost a way of life. Oh, of course I'm gonna zoom into my doctor, and we're gonna discuss this. I'm not gonna, and you think about health equity, right? To the extent that, okay, internet, you still need the connection, you still need the accessibility, but you're then removing the fact that I don't have bus fare to get to my appointment. I don't have a car. It's raining today. I can't go out. Let me reschedule, right? And then, and human nature being what it is, all of a sudden you reschedule something, and now it's no, I forgot to go, and something gets compounded. Being in the moment here and being able to connect physicians with patients and providers here, right in their home or their study, is really at the basis of what preventive medicine's all about.
Yeah.
Getting out in front of that next thing that could go bad.
Yeah. Yeah. So this goes back to efficiency again, and in New York, you may not get this, although I know you've been in Texas a few times, but we have these nasty little things called fire ants, and you walk out in your front yard and there's a fresh mound of dirt, and that's fire ants. And if you've ever been bit by them, fire ants have some kind of technology. I don't know what it is, but they all crawl on your leg and then they all bite at once, and you feel it for a week. It's super painful. And so down in the South, where we have these critters, everybody knows, everybody's got a teaspoon of something in their garage, and you go and you put it on the fire ant mound, and then they're gone. In healthcare, we do it like this. Rather than going out, seeing it, getting the teaspoon, putting it on there, and they're gone, we call the Pentagon, and they send a brigade of military guys with tanks and air support, F-16s, and they come in, and boom, 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 they get rid of the fire ants. That's how we do things in healthcare. The great thing about Teladoc was we said, it's more like the teaspoon, right? And that's what Recuro is also going to do. Rather than, if you think about your automobile, you sit in that car, how many people do you see on the side of the road who have run out of fuel? Not many. I mean, people that are pushing it, but why? Because we have a low gauge. We know when the fuel tank is getting low. We know when the temperature on the engine is getting high. We know when the battery is getting low. We know when it's time to change the oil. We know all these things in our car. We know nothing about our body. We don't know when our lipids are getting high, or, we don't know these things. And so what we need to be able to do is create these simple little gauges that we can deliver to people. And when we start doing that, we'll keep people healthy, because we'll catch things before they're stuck on the side of the road and it becomes a disaster.
It's like a human dashboard, right? It's kind of, it's your own check-in on here's how my vital signs are doing. Here's how I'm feeling today. And really a self-awareness when you think about it. I loved your needle in the haystack, but bring a magnet. Analogy. That to me is that kind of sums it up. It's like, why go one at a time? Let's go in and let's grab all of it, and try to do some good here as we fix this into the future. Well, Michael, thank you for joining us today. What a tremendous success and story. Congratulations on all of your innovation, your disruption. It's interesting what you said about how words sometimes matter, right? As you said, growing up, don't be disruptive would be viewed as, best behavior. Think about what your parents used to say, those of us 40 or 50 years ago, 60 years ago. Don't get in a stranger's car. Now all we do is look to get in strangers' cars, right? So it's kind of interesting how things evolve over time, and we move forward. But listen, congratulations on all your success. Best of luck here with Recuro as we move into the future. Recently we were featured in Forbes magazine. That was a tremendous article. Congratulations on that as well. And thanks for all you're doing for the healthcare system, for public health, and the community at large. It's some wonderful work, and we wish you so much success and continued best wishes in the future.
Well, same to you and the leading entrepreneur. If I can do anything for you guys, let me know.
Thank you, Michael. And thank you for having your LinkedIn information up ahead of time. And thanks for being receptive to our audience's outreach. Much appreciated. Take good care of yourself. All the best. Thank you so much.
You bet. Thanks.
Take care. Bye.